Hello friends, myself Dr. Manish from Surendranagar, Gujarat. Today we are going to talk something regarding anemia and postpartum hemorrhage. Postpartum hemorrhage means loss of 500 ml of more blood during normal delivery or more than 1000 ml of blood in cesarean section. Postpartum hemorrhage is a burden in society. Recently, we have got very bad incidents in our history of gynecology that one lady has committed suicide because one of her patient has gone for postpartum hemorrhage. If we see prevalence in India, more than 33% of women are going for postpartum hemorrhage. Postpartum hemorrhage can occur because of 4T tissue, that is placental beads or cotyledon or membranes are retaining inside the uterine cavity. Thrombine, patient is suffering from coagulation problem. Trauma, that means tear in the cervical canal, tear in the vagina, deep tear in the uterine cavity, and most important is stone. When there is atonicity of the uterus, uterus is not able to contract and there is a lot of blood going through from the uterus into the vagina. To control that tone, we must have got motive in our mind. What we mean by motive? Massage the uterus, that is M. Use oxytocin, that is O. Use tranexamic acid, that is T. Use plenty of IV fluids because patient is going in hemorrhagic shock, and evaluate the cause of postpartum hemorrhage. In our armamentarium, we have got so many uterotonic drugs available with us, starting from methylargometrine, oxytocin, prostaglandin E2, and recently we have got carbetocin. We have to use all these drugs in combination or alone to control the postpartum hemorrhage. But even with this drug, if postpartum hemorrhage is not able to control, then we have to go for surgical intervention, that is stepwise devascularization of the uterus. First we have to ligate the uterine artery, then we have to ligate ovarian artery. If it is not suffice, then we have to ligate interiliac artery. We can have all different varieties of suturing modality in uterus, starting from Billin stitch to Cho stitch, and recently we have got Komok technique that is designed by our own Dr.Manish, that is compression of uterus and occlusion of the uterine artery. But even after controlling postpartum hemorrhage, the lady is suffering from anemia. When there is severe anemia, we have to control this anemia by using injectable iron. In our armamentarium, we have got iron sucrose, Ferric Carboxy Maltose, and recently we have got isomaltoside. I am fortunate that I had done study of all these three different molecules. When I was a professor in Susa Medical College, we had studied 500 cases of iron sucrose in postpartum pregnancy or postpartum stage. And I am happy that because of that paper, Government of Gujarat has initiated this thing, and now every PHC and CSC we have got iron sucrose freely available. And I am also happy to announce that the auto dilution dose is designed by us. What it means? We have to take 5 ml of iron sucrose with simple butterfly. We have to draw 5 ml of maternal blood, and this 10 cc of blood we are injecting slowly into the maternal circulation, and with 2 injection of iron sucrose, at least 1 to 1.2 gram of hemoglobin increase in the lady in postpartum period when she has got severe anemia. Recently we have got FCM, Ferric Carboxy Maltose. Ferric Carboxy Maltose are coming in 1000, 5000 and 10,000 Dalton volume. Only fallacy of this Ferric Carboxy Maltose that it should be consumed within the speculated time of 15 minutes. And I am also happy to share that we had done prescription based study of 543 patients with Ferric Carboxy Maltose, and happy to share that with one injection of Ferric Carboxy Maltose in severe anemia, we have got increment of hemoglobin 1 to 1.5 deciliter. Now, another drug in our armamentarium is iron isomaltoside. Here iron isomaltoside compared to Ferric Carboxy Maltose, we can use it in a full dose. When we are student, we are doing all this total iron replacement, that is TDI, that can be possible with iron isomaltoside. We can give full dose by calculating by Ganazoni formula. We can see how much the deficit of hemoglobin, and according to that we can inject injectable iron in normal saline in 500 ml slowly Here there is no time limit, we can give up to 1 to 2 hours because this molecule is not stable compared to Ferric Carboxy Maltose, which we have to consume within 15 minutes. After injectable iron, for the correction of anemia, we can also give hemoglobin tablet supplemented with vitamin C and vitamin B12, because iron also require vitamins on the back, that from Fe+2 to Fe+3 going into the circulation, and it is stored in reticuloendothelial system and anemia will be corrected. Thank you very much.